Hi, I'm Kayla Del Biondo, Symbonus Librarian for Public Health at the Cushing Whitney Medical Library at Yale University. I worked with two colleagues, Holly Grosetta Nardini, Associate Director of the Medical Library, and Kate Nyan, Research and Education Librarian for Public Health, to conduct a study on open access viewpoints and self-archiving decisions of primary faculty at Yale School of Public Health, also known as YSPH. This virtual poster for the 2023 Society for Scholarly Publishing annual meeting is titled Some People Have Access and Some Don't, Exploring Open Access Viewpoints and Publishing Decisions of Public Health Faculty at Yale. In a preliminary assessment we conducted, we researched Web of Science to retrieve all papers published by YSPH faculty across two departments in a single calendar year. Approximately 18% of papers were not openly available, either by gold or green open access. Two central research questions we explored as part of this project are listed in the top left of the poster and relate to faculty beliefs and faculty behaviors. These were: 1. What are faculty authors' understanding and viewpoints of open access, particularly green open access or self-archiving? And 2, what is the information-seeking behavior of YSPH authors finding information about journals' publishing practices? The simple answers to these complex questions are that public health faculty understand open access as free access to literature for anyone. Some faculty do self-archive so that their work is out there more quickly to the general public, and some do not. And most public health faculty navigate to individual journals' websites to find publishing information and/or rely on past experiences when making submission decisions. But let's discuss our methods and findings in more detail. Our research methods included an 11-question survey emailed to 102 primary faculty, followed by semi-structured interviews with 8 individuals who volunteered during the survey process. Most of our questions were open-ended as we sought to learn about faculty processes. For example, our first interview question was, "Tell me about your typical process when you set out to publish a paper. Please be specific about the decision-making factors you consider." According to our survey data, faculty consider journal reputation and what journal might be the right fit given the research topic when deciding where to submit a manuscript. 15% of respondents meet with librarians to ask them publishing questions, and we gathered during the interviews that public health faculty want librarians to tell them about read and publish deals at Yale, along with journals that have better practices. The majority of respondents consider whether their work will be openly available when deciding where to submit a manuscript. The image shown on the poster is meant to depict the Greek goddess Cassandra, who one of our interviewees used as a metaphor to describe subscription-based publishing models. This interviewee said, "Pay-to-read literature is like the old Greek myth about Cassandra. They punished her by giving her the gift of prophecy, but no one could hear her. Well, we know what's happening because we are doing the research, but nobody is hearing us because they don't have access to our work." This quote portrays the belief that all interviewees voiced: open access promotes information equity. Faculty also cared about speedy publication, especially during a public health emergency. Some concerns that faculty voiced during interviews were in regards to APCs for gold OA publishing, especially in the case of junior researchers who may not have research funds. It's important to note that our study was mainly concerned with faculty perceptions. The title quote and the Cassandra quote suggest that faculty are concerned with information inequities that arise when work is not free to read, when in reality, the majority of YSPH authored work, according to our early assessment, is open, and nearly all of the articles that were not open were published in journals that allowed self-archiving. We found that 56% of survey respondents say that they do not self-archive when they publish an article through the subscription publishing route. And the interviewees who do not self-archive claim that they were lazy or busy or both. They thought that they weren't allowed to unless they paid the APC for gold OA, or they think that there is a preference towards the final peer-reviewed manuscript in health science research. Thank you for listening.